And I think we should not forget what a big role that was. So we really appreciate what you did during these rough 2 years. Today we're at the conference for the antimicrobial resistance. There was a Muscat manifesto that was signed, but I think more than 30 countries signed that. How do you see 40 countries signed it? Okay, how do you find the response to this conference? How was it?
Yeah, maybe to any comment about the conference, probably the last session could tell you, the last session where almost all ministers spoke. Before the closing, there was a 2 hours open session where statements from ministers was presented. I could see there was really good political commitment, and they endorsed the Muscat manifesto. And the manifesto has 3 targets, which are very ambitious and also concrete. But in addition to that, there are also 2 additional objectives, like revising the plan of action, strengthening the surveillance. But there are 3 other targets that are very concrete and ambitious in terms of the use of the antimicrobials that we have. For instance, less use in both humans and animals is one area that they have agreed, and with a clear target. And there are some critical medicines also, 0 use actually of those medicines in non-veterinarian condition, and other targets. So I think the conference was very successful, where we have seen full commitment to the manifesto, and people even saying, let's now move on into action. And there is going to be a UN General Assembly in 2024, September. So they have also agreed to prepare a roadmap and to do everything, roadmap between now and 2024, and to do everything to implement the manifesto, these ambitious targets. And I hope we can make progress.
And prevention is always better than cure. Are we at a point with AMR where we're still at the prevention stage, or are we moving towards now we're trying to cure the problem that has already started?
If we're going to be successful in AMR, it should actually start from prevention. And many speakers were focusing on infection prevention and control. That's where, if you prevent infection, then you don't need the medicine. If you don't use it, then you don't abuse it. So that's the whole idea. You start from prevention, and then you can move into, of course, controlling or managing. But the infection prevention and control is key. But when we say prevention, it's in all the One Health. That's why we have the One Health approach. It's not about what we do with the healthcare only, but it's in the animal, in the plant, and also the environment. So we have to approach in all sectors through prevention lens. That should be the first step, and then of course move into the rest. But prevention should be at the center.
Okay. COVID-19, the global response to COVID-19. Do you think it was a good global response, or could we have done better?
In anything, by the way, you could always say we could have done better, because this virus was unknown. It's a novel one. Mm-hmm. So what we didn't know was more than what we actually knew. So from the start, there was this problem. So we're just learning, and then when you learn, of course, you also learn from making mistakes or from failures. So that's why it could have been done better, but at least we're where we are now, in a better position. The COVID situation has significantly improved, and that's why we're meeting, and the world is opening up again. So we're in a better position now.
Okay. So my last question is, do you feel that as an international community, on a global level, have we learned maybe how to work together in a better way from the COVID-19 pandemic. So, for example, now that we're tackling this AMR issue, do you think we're working together better at a global level?
I think one of the problems is, as you said, the lack of solidarity.
Okay.
And we have been saying from WHO, without solidarity, global solidarity, it's very difficult to beat this virus. So we have been asking for national unity at the country level also, not to politicize it. And based on that also to have global solidarity, because this pandemic is global, so global response is the answer.
The pandemic, the AMR pandemic?
No, the
It's the
COVID
okay.
Pandemic. So if there is one lesson we have learned, solidarity is important was important for COVID. And that's why now our member states are negotiating on a pandemic accord or pandemic agreement, or some call it pandemic treaty, to bring all our lessons together and agree on a framework so we don't make the same mistakes if another pandemic comes. But the same, the principle of solidarity, not only for COVID, but it will be also important for AMR. It will be important for other things also, especially global threats that needs global response. So the COVID could be a very good lesson. I think many people are saying we have learned our lessons, and that's why we're working on a legally binding agreement, not to make the same mistake. And the basis of this accord or agreement will be solidarity, equity. So if we manage to have this agreement or treaty by 2024, as already said, agreed, then we're serious about solidarity. That's when I will say we're serious about solidarity. So it's in the making now, and we hope countries will bring it to a successful conclusion, and then we will say, okay, we have learned our lessons. That's why countries have agreed to have this agreement. And inshallah, we will hopefully have this agreement, yeah.
Thank you very much.